Hi, welcome to our new segment, Ask Dr. Tarman. My name is Dr. Vera Tarman and I'm the Medical Director of Renaissance. I'm an addiction specialist. What we're doing here tonight is answering a question that you can ask, and I'm going to, every third Sunday of the month, come here and answer your question. So our first question for tonight is from Dave in Sarnia. Dave, you asked the question, how do I know if I'm addicted to a drug? Well, anyone that takes a drug, whether it be an opiate or a sleeping pill like a benzodiazepine, if they take it for more than 2 or 3 weeks and then they stop taking it, they might have an actual physical withdrawal, which we call dependency or tolerance. And that's not addiction. That's just physical, maybe shakes or sweats or fluish-like feeling. That's because you stopped the drug and the body's got to adjust. What we call addiction is when you have the behavioral piece on top of that, the obsessions, the using the drug even when you want to stop and you find that you can't because you keep thinking about it. You have physical discomfort, and you know that you shouldn't use it, but you're going to use it anyway. It's causing problems in your life, in your marriage, in your job. That's what we call addiction. So Dave, I hope that's been helpful to you. And for those of you listening, please email your questions to sanderson@abusehurts.com, and I'll be happy to come back and answer your question. Thank you very much for listening. Hi, I'm Dr. Tarman, and I'm back here at our section of Ask Dr. Tarman. And this is the chance where you get to phone or email a question in, and every third Sunday of the month I come in and I answer the question. So our question from today is from Jeff from Brantford, and he asks the question, how can I tell if someone is addicted to a drug? I guess they might be thinking about their parent, their spouse or their child. Well, you're not a specialist, so you're not going to be thinking about it in the same way that I might be thinking about it. But these are the things that you would look for. You would look for changes, particularly in behavior. Is the person changed their personality in such a way that it's just not the way they usually are? They're more moody, they're not sleeping as well, they're keeping odd hours, they're not able to function as well as they used to, and they were doing really well. So it's almost like a night and day type of thing. When you see that happening, you can wonder. Then there's some other things, like are they having problems at work? Are they having problems with their relationship in a way hasn't been evident before? These are signs that suggest that there might be something going on. The thing I really want to point out is it's not the kind of thing that they themselves will recognize. One of the things we know in addiction is what we call denial. A person is unable to see the problem, and it's often they see the problem last. So I hope that, Jeff, has been helpful to you. And for those of you listening, please email your questions to us at sanderson@abusehurts.com, and I'll be happy to answer them. Thank you very much for listening.